Good afternoon, everybody. I want to thank you for taking the time out of your day today to join us for this important webinar called Starting the Medicare Conversation that will present some important talking points and concepts to help you initiate this important conversation with your clients and prospects. Before we begin the presentation, I want to let you know that there is an opportunity for questions and answers. To ask a question, just type that into the chat box that you see there on your GoToWebinar control panel there on your computer screen, and I'll be sure to address all questions at the conclusion of the presentation. Of the 10,000 baby boomers turning 65 every day in our country, many may be your clients who have come to trust you for other important insurance and financial coverage. They trust you for some of the most important matters, like homeowners, auto insurance, or investments. And now it's important that they need to know they can turn to you for their Medicare guidance and answers. This presentation will point out some important talking points and concepts, provide a brief overview of Medicare, and some strategies to help you initiate this important conversation and provide more value to your clients. Insurance advisors need to move their focus from helping clients accumulate wealth to helping them preserve and protect it. It's important that you educate your clients on the high costs of health care in their retirement years. The Center for Medicare and Medicaid Services, CMS, estimates that Medicare's total annual cost for people in good health is $7,620 in 2017. Those who have chronic conditions like diabetes or heart conditions can expect to pay as much as $12,000 more per year. This estimate applies to retirees with traditional Medicare insurance coverage and provides a general idea of the monthly expenses associated with Medicare premiums, Medicare co-payments and deductibles, and prescription drug out-of-pocket expenses. Another popular study that's very well known in the industry is Fidelity's annual study that reports this year that a 65-year-old couple retiring in 2016 will need an average of $260,000 to cover medical expenses throughout their retirement years. That number is up from $245,000 from Fidelity's report in 2015. Fidelity also estimates that a 65-year-old couple would need $130,000 in additional savings to insure against long-term care expenses. And it's important that you tell your clients that you say, I can help you provide a protection against these high out-of-pocket expenses. In most situations, you will know your client's age and can ask these simple questions to begin this important Medicare conversation. In regards to your health coverage, are you self-insured? Do you have a Medicare Advantage plan or a Medicare supplement? If your client already has coverage, it's recommended to say something like, if I may review your costs, I may be able to save you money without losing any benefits. If you're unsure of your client's coverage, you can say, I can help lessen your burden of determining the health care coverage you need and guide you in choosing the Medicare coverage that best meets your needs. Perhaps your focus is on financial planning, where you've provided life insurance or an annuity to your clients. Who do you want advising your clients on their health care costs? It's important that you inquire on their health needs and that you don't risk losing this business. Because when you risk losing your clients for just Medicare, they have the opportunity to go to somebody else who also advises them on life insurance or annuities, and you risk losing your entire business with that particular client. So it's important to encompass the entire financial picture to include health insurance when talking to your clients. Perhaps you know your client's financial picture, and you can find out what they have and what they spend for coverage for health insurance, and say, let's see if I can lower your health insurance premium. When one turns 65 and is on Medicare, there are two options available to them to help them lower their out-of-pocket expenses. They can either go on a Medicare supplement plan or a Medicare Advantage plan. Medicare supplement plans, also known as Medigap, pay for the gaps, the copays, the deductibles, and coinsurances that are in Original Medicare Parts A and Part B. It is very important to point out to your clients that if they were just to stay on Original Medicare Parts A and Part B and not get a Medicare supplement plan, they would have to pay the $1,316 deductible out of their own pocket if they were ever admitted into the hospital. Most Medicare supplement plans, including the two most sold plans, Plans F and Plan G, pay for this deductible. This alone justifies the cost of any Medicare supplement plan. It's also important to note that Medicare supplement plans are affordable monthly premiums with no network restrictions. They can go to any doctor or provider that they wish, with little to no out-of-pocket exposure. Medicare supplement plans offer standardized benefits. Medicare Supplement Plan G can provide significant savings to your clients as well versus other carriers' Plan F. And most Medicare supplement plans do not require any agent certification. Now that we've spoken a little bit about Medicare supplement plans, it's important to know when you can enroll your clients. The Medicare supplement open enrollment period is a 6-month period that begins the first of the month that one has Medicare Part B and is at least age 65. During this period, carriers are required to issue any Medicare supplement plan applied for. If one is past his or her open enrollment period, they may still have an opportunity to receive Medicare supplement coverage without having to answer any health questions if they qualify for a guaranteed issue scenario. The most popular guaranteed issue scenario being involuntary loss of credible coverage that was primary to Medicare. In this situation, beneficiaries can then apply for Medicare supplement plans A, B, C, F, K, or L. Plan G is not available in a guaranteed issue situation. Other guaranteed issue scenarios are specific to losing Medicare Advantage coverage. And if you have specific questions regarding those scenarios, please be sure to let us know. Insurance carriers often can pay a lower commission as well for guaranteed issue business. Medicare Advantage plans are Medicare health plans, a plan offered by a private insurance company that contracts with Medicare to provide Part A and Part B benefits to people with Medicare who enroll in the plan. Medicare health plans include all Medicare Advantage plans, Medicare cost plans, demonstration or pilot programs, and programs for the all-inclusive care for the elderly, or PACE. Medicare Advantage plans include HMO, PPO, private fee-for-service plans, special needs plans, and Medicare medical savings accounts plans. Most Medicare Advantage plans offer prescription drug coverage, but some do not. Medicare Advantage plans do require that the policyholders continue to pay their Part A and Part B premiums. Medicare Advantage plans cost zero to little premium per month, though, in exchange for higher out-of-pocket costs like deductibles, copays, and coinsurances, which are capped anywhere from $3,400 to $6,700 per year. Some Medicare Advantage plans include benefits that are not part of Original Medicare. And it's important to note that anybody who wishes to sell a Medicare Advantage plan must be required with that particular carrier that they intend to sell. When enrolling into a Medicare Advantage plan, there's your initial election period, which is 3 months before the month of the 65th birthday, the month of, and 3 months after. It's important to note that the initial election period is strictly dependent upon the 65th birthday and not enrollment into Medicare Part B. There's also the annual open enrollment period when one can enroll, which is October 15th through December 7th of each year, with coverage then being effective on January 1st. In addition to these most common election periods, there's also special election periods. Loss of employer group coverage is the most common special election period, in which case one has 60 days from the date their group coverage terminated to enroll into a Medicare Advantage plan. Several other scenarios also qualify for a special election. If you think you may have an opportunity for a special election period for one of your clients, please be sure to give me a call. There's also the annual Medicare Advantage disenrollment period, which is January 1st through February 14th of every year, when those who are enrolled into a Medicare Advantage plan can disenroll from that Medicare Advantage plan and then apply then for a Medicare supplement and a standalone prescription drug plan. It's very important to understand, though, that enrollment into the Medicare supplement plan is not guaranteed, and clients have to, in most situations, go through medical underwriting. So it's very important to not disenroll from the Medicare Advantage plan until you know for certain that the Medicare supplement carrier has approved enrollment into their Medicare supplement plan. Medicare Part D prescription drug plans are offered by private insurance carriers for a premium. They are tiered drug systems and copays, so each drug is classified into a specific tier, and each tier has a corresponding copay. Medicare prescription drug plans are standalone plans or can be combined with Medicare Advantage plans. And they also follow the similar enrollment options that we described a minute ago with regards to Medicare Advantage. There's your initial election period, the annual open enrollment period, and special election periods as well. The disenrollment period that I mentioned previously is only specific, though, to Medicare Advantage plans and not standalone prescription drug plans. Now that we've gone over some basics of Medicare Parts A, B, C, and D, and Medicare supplement plans, we're going to spend a little bit of time discussing some strategies and how to go about selling Medicare plans and advising your clients on their healthcare costs in their retirement years. Medicare is all about a trust sale. It's important to build upon the trust that you've already established with your clients. Seniors are clamoring for guidance on their Medicare choices, so to be sure to offer guidance on the best options for them. It's important that you don't need to be the expert, but just to know the basics of Medicare and to be able to let your clients know that they can come to you for enrollment into a Medicare plan. When you're not sure of a specific question or an answer, just give us a call here at Art Jetter & Company for the expert answers and guidance. It's important that you don't focus your marketing efforts on just those people turning 65. The 40-year-old client who trusts you for all of his life or P&C needs will certainly want to refer you to his parents or loved ones for Medicare guidance. Selling Medicare plans provides tremendous value to the client relationships. It's important that you don't just sell one policy, because when you sell just one policy to your client, you can risk losing them to another client who's going to offer a more comprehensive portfolio of products to your clients. Property and casualty carriers and their agents have mastered the bundle concept. They provide home, auto, boat, and maybe even life insurance to their clients. But why not Medicare too? When you incorporate this bundle concept, you become a one-stop shop for your clients' life, and health insurance needs. Each additional policy you sell dramatically increases your client's persistency with your business, puts more money in your pocket, and most importantly, really provides a tremendous value to your relationships that you have with your clients. As part of the Medicare conversation, it's really important that you ask the right questions. Like, how do you pay for dental care? Could you use some extra cash to cover a hospital stay? Or what happens if you get cancer? Are you insured in the event you would be confined to a facility? These are common needs amongst seniors. And a senior dental policy, cancer coverage, or hospital indemnity plan can provide these needed benefits. Just asking these simple questions can strengthen the relationships you have with your clients, lead to more sales, and help you make more money. Each time you don't ask those questions, you're leaving significant amounts of money on the table. Asking those questions can lead to a sale 50% of the time. In this illustration here, you will see what I would refer to as the compound effect when it comes to Medicare supplement commissions that you can earn. Medicare supplement commissions are level commissions for 6 years. In this example, we provide an example of at least 20% commission, though most of our carriers are offering a more than 20% commission. In the compound effect, you will see that you earn your commission each year for your new business sales. But beginning in year 2, you earn your new business commission plus your renewal commission on existing business. So in this example of just Medicare supplement sales with a plan at a $1,500 annual premium at 20% commission, after 6 years, you're earning more than $90,000 on just Medicare supplement sales. Now, if you add a dental policy or something that hospital indemnity or cancer coverage that we previously mentioned, you're going to be earning well more than $100,000 in annual commission on your senior health business. Once your client knows the importance of purchasing a Medicare supplement plan, you can turn the conversation towards the specific carrier, where you focus on brand recognition, the financial strength of the carrier, or superior customer service that the carrier provides. Ensure the business transaction by submitting the application in a smooth process by submitting it electronically. Electronic applications are often issued within minutes, and many carriers offer a temporary insurance ID card that can be emailed to your clients or the applicants within just a few hours after the applications are submitted electronically. Certain carriers that offer multiple products make it incredibly simple for you to offer your clients additional products like dental coverage with just a simple click of a mouse when using its electronic enrollment process. The Medicare conversation is not a difficult conversation to start. Just knowing the simple basics of when to enroll, the options that are available to your clients, and what is covered is extremely valuable. Making it even easier is that the benefits of a Medicare supplement plan, like plans F and G, are the same regardless of the carrier. The benefits are standardized. This makes it simple for you to demonstrate the benefits of a Medicare supplement plan regardless of the carrier that you're going to be selling to your clients. And again, when you don't know the answer, just give us a call. While we are life, health, disability, critical illness, annuity, long-term care, brokerage, general agency here at Art Jetter & Company, we are specialists in our own respective markets. We can answer all your questions about Medicare or disability or critical illness or whatever the particular market that you are in, and you'll be speaking to a specific specialist. When you have questions about contracting, you can speak to our contracting manager, Sarah Davis. And if you submit a paper application, our new business team led by Alan Davis does a tremendous job processing and providing status on applications. If you have a specific question regarding medical underwriting, our chief underwriter, R.D. Coffeen, who has 30 years of experience in morbidity and mortality underwriting, can advise you. We also have a great incentive and lead generating program at Art Jetter & Company, where we provide 100 free names of people turning 65 when you become appointed with our Medicare supplement carriers, and also for issued business, where we provide 200 names for any issued e-application that you write. One of the premier tools that we offer at Art Jetter & Company is our Medicare Supplement Quote Engine. It's the industry's premier quoting tool that provides our appointed Medicare supplement agents the ability to shop the market for the most affordable options for your clients and provide them with customized quotes. The quote you will provide will include more than just the rate, but an outline of the benefits each plan provides and other important information like the carrier's experience and AM Best rating. You can request access by visiting our website at jetter.com. That does conclude the formal presentation now, and we'll open it now for questions and answers. If anybody has any questions, again, please be sure to type that into the chat box that you see there on your GoToWebinar panel. One of the common questions that we do receive is regarding prescription drug plans. We do offer a portfolio of prescription drug carriers to include United Healthcare, AARP, Aetna, and SilverScript. And we have a portfolio of close to a dozen Medicare supplement carriers, 6 of them being most competitive nationwide, including Mutual of Omaha, Aetna, Cigna, Transamerica Premier, and Medico. So someone asked, does Plan G always require medical underwriting? So Plan G, when you apply for a Medicare supplement plan during someone's open enrollment period, again, that 6-month period from Medicare Part B, the carrier is required to issue any Medicare supplement plan applied for. But when they're applying during a guaranteed issue situation, Plan G is not available in a guaranteed issue when they're past their 6-month open enrollment, but they're coming off of a group plan, already enrolled in Medicare Part B for more than 6 months, and they have a guaranteed issue. Plan G is not available in that situation. If they wanted to apply for Plan G, they would have to go through underwriting. So I appreciate everyone's time this afternoon and joining us for this special presentation. You can look to our training calendar that's sent out every Monday for additional trainings that we're going to be offering. And if you have any questions at all, please feel free to email us or your respective specialist, or you can email us at the group at seniorhealth@jetter.com. Again, thank you all very much for joining us today. I hope you all have a very successful rest of your day and rest of your week. Thanks so much. Bye-bye.